The most underutilized tool in healthcare isn't technology, it's trust. Until we invest in human connection with the same urgency we invest in tech, behavior won't change. But when people feel supported, improved outcomes and savings follow. That's according to Rick Lee, CEO and co-founder of Healthrageous, a company redefining how health plans engage the 65-plus population. The result? Older adults feel supported, plans see real savings, and healthy behaviors finally stick. Rick has had a remarkable career spanning more than 4 decades in health policy, health plans, and digital health entrepreneurship, and now he's tackling one of healthcare's toughest challenges: how to truly engage members and build trust at scale. Rick, welcome to Life Sciences Decoded.
Thank you. Pleasure to be here.
Great to have you. So let's start with an intro to Healthrageous. You've said that Healthrageous has often been misdiagnosed as a meal provider, when the meal is really the on-ramp. And it's the way you start building trust and engagement with the 65-plus population. And once that trust is built, you take it a step further using data and insights to deliver personalized nudges that go way beyond nutrition. Can you walk us through how that entry point actually works and what's going on behind the scenes at Healthrageous to pull this off?
Sure, Megan. So let's focus on the fact that Maslow's hierarchy is on the bottom rung is food and nutrition. And if you don't have food and nutrition, you can't reach a level of growth and maturity that is what most people seek. So today we're seeing serious repercussions from denying 42 million Americans their SNAP benefits. 17 million of that group are children who can't even vote for a political party responsible for this harebrained idea. So naturally, we Healthrageous start with friction-free, nutritious prepared meals, and we target the people who are the costliest to a health plan. These people have not only been the costliest to the health plan in 2025, but they've been the costliest in 2015, 2005, 1975, 1955. They've always been there. They're the 3 to 5% that cost more than 50% of the healthcare expenditures. So this is not rocket science. You've got to figure out a way to reach those people. And what we're finding today is that digital communication has gotten really cheap and very inexpensive, yet connecting with people is not that easy. So even though it doesn't cost much to send out global emails to 100 million people, if you get a return of less than 1%, you're lucky. If you get no returns, that's predictable, and you're just like every other firm. You haven't figured out the secret sauce. So our secret sauce is to use meals, which is something that everybody covets, and to use that as a way to build trust so that we can ultimately communicate with the targeted population, the high-cost people, and deal with their additional needs that are going to be front and center in their lives and will become front and center in the health plan that we serve.
You have said in some ways we've become too dependent on technology, that there's always a shiny new app or some new dashboard promising to fix healthcare. But in your case, technology is still what delivers the experience, yet you've chosen to keep it incredibly simple, reaching members through SMS and other means. Why is that simplicity so important?
I think simplicity is important regardless of what business you're in. The keep it simple, stupid motto has been a part of all the businesses. I've created 9 different companies over the last 40 years. And in each one of those, trying to keep it simple, stupid, and I'm the stupid one, is entirely appropriate. We know that more than half of seniors have reported in surveys that they've never downloaded an app for their management of their health care. That's not to say that they've never downloaded an app. They do it for photos from their grandchildren, and they do it for a variety of other reasons. And maybe one of those is to get meals from a local restaurant. But they are not downloading it for their health plan. And this is why you have to make it really simple for them. We've used SMS text without a username or password. And that way we are able to engage with our seniors. Now you say, how do we start with that engagement? We have something that's attractive to them. It's called meals. If they want the meals, they can call our call center, they can go to our website, or they can hit the SMS short code, 5 numbers, and they'll be right into our site. And they can enroll, and then they can order meals from that site. We've eliminated the friction. We recognize that people don't like to download apps for their healthcare, seniors don't. And thus, we've opened the pickle jar for them and made it easy for them to get to the pickles without the stress and fretting over, I can't, my arthritic hands don't work here. I don't remember my username or password. I don't know how to turn on the computer. You've heard these complaints from seniors, and they are realistic, and they are part of the lives that we seniors live every day. Too much friction, not enough, keep it simple, stupid.
You also use this technology and SMS for nudges beyond just meals. Can you expand on that and explain how that entry point of getting their attention and their engagement through meals is also leading to going to doctor's appointments and taking care of themselves and walking and getting exercise?
So nudging is a particularly effective way to motivate people to do things that they aren't thinking about. And oftentimes a simple nudge like, have you drunk enough water today? It reminds people that is a goal that I have. That's a goal that my doctor told me I should pursue. And I just keep forgetting about it. You know, I have the coffee in the morning, and then before I know it, it's noon, and I haven't drunk 1 ounce of water between coffee and noon. If you remind people, and in my case, I have this water right here, and oftentimes I'll be doing an interaction with somebody on Zoom, and I'll do this, and I'll drink a sip of water, and that'll be a nudge for them. And perhaps they're only 35 years old, but they haven't drunk water since the coffee they had in the first thing in the morning. So it's that kind of nudging. Get up, move around, go upstairs, come back down the stairs, get the blood flowing. All these nudges, if they're delivered through SMS text, so they're not interrupting your life, and it's less than a sentence, it's a phrase, and thus it can be integrated into your brain while still having a conversation with somebody on the other end. And that's essentially why we find nudging to be particularly effective.
And it really helps with caregivers, because I have a 91-year-old uncle who I do call and say, have you had any water today? Because I'll hear I'm a little tired or I'm a little lightheaded. Oh, I forgot to drink water. So it's a small, simple approach, but it's a big one, because dehydration causes falls, causes all sorts of issues later in life. I wanted to go to the report that you recently released called Ease, Engagement, and ROI, What 3 Years of Data Have Taught Us. You looked at more than 28,000 members and found an average savings about $2,000 per member per year, with significant drops in ER visits and inpatient visits. What surprised you the most about those findings?
I think the most surprising factor is that when you regulate behavior, you're acting like a police person. So if we sit on the highway with a radar gun and pull everybody over who's going 1 mile over 65. We're changing behavior, but we're doing it through a punitive means. If we stick a sign that flashes speed limit is 65, you're currently doing 66. That's a biofeedback loop that communicates to the individual that something that they may have forgotten about, not paid attention to. Maybe they're on a call in the car and they're thinking about other things and they're all of a sudden speeding. So biofeedback loops are terrifically effective. And what has happened in America is we are relying too much on regulatory and punitive interventions rather than biofeedback loops that lead to self-change. So if I tell you after you take your blood pressure and you see your score and it's 155 over 92, you may be concerned. But if that goes into an internet stream and into the mainframe and then comes back to you in a message that says that's 18% higher than your average BP for the last week, now you have those two numbers framed in context. And the context is you should be doing something differently this morning because your blood pressure is skyrocketing. And that gets you to think about, oh, well, maybe I didn't get enough very good sleep last night, or maybe I drank too much alcohol last night and that dehydrated me, and dehydration leads to my kidneys having to work harder. And if they work harder, they draw more blood and that increases my blood pressure. Okay. A biofeedback loop just informed me as to why my behavior last night is impacting my health today. And that's all we try to do with ease of engagement, trying to bring to the attention of our people that we're serving ways that they can invest in their own health, which has been proven to reduce the total health care costs that they submit to their health plan. And it's not by doing regulation, by depriving them, by pre-authorizing them, by not permitting them to get surgeries or certain medications. All that is punitive and regulatory and unnecessary if you create somebody believing in how they can improve their health by being invested in their own improvement.
So engagement and mindfulness has a bigger payoff than all of these traditional interventions in healthcare.
I believe that's the explanation for the $2,200 difference. Yeah.
So when you look at the 65 plus population, this isn't a niche, it's a massive and growing segment. How big is the opportunity for a model like Healthrageous, and what does that deliver not only to health plans, but to members in the broader community?
Well, there are 34 million members, seniors in Medicare Advantage plans. And for the first time, there are more seniors in MA than there are in Medicare fee-for-service. That is only going to grow and increase, and the ratio will be 2 to 1 within probably by 2030. So Medicare Advantage is here to stay. The question is, how big is the opportunity for addressing that population? We think that the 3 to 5% who cost more than 50% of the dollars is baked in. As I said earlier, it's been the problem since the 70s, and it will be the problem in the 2070s. So what are you going to do about that population? That population we see as being socially isolated, and in some respects, there's an epidemic of loneliness that is impacting them. And that impacts the bottom line of health plans. So that is our next creation, Hello Made Easy, which is a solution for those who are socially isolated, oftentimes living alone. They have 4 or 5 different chronic conditions. They have 4 or 5 different physicians that they see. They have 8 or 10 different medications that they take. It's a completely chaotic solution or problem that they're interacting in, and their ability to rise above it and pursue a healthier lifestyle is impinged upon by all these various impacts, including loneliness. So we think that going back to the Maslow hierarchy, if you deal with calories and put calories in their mouth, you've solved one of the problems. If you deal with social connection, we are human beings. Human beings need to be interacting with other human beings. That's the God's honest truth, and it applies to 90% of the human beings on the earth. So if you solve that problem, then there'll be a third or fourth or fifth problem. But slowly and surely, we're using non-healthcare solutions that are not related to the products and services that have been deployed by health plans over the last 50 or 70 years. And we're using those under the rubric of social determinants of health. And we find that social determinants of health can impact the bottom line for the health plans that we serve.
So really simplicity, engagement, technology, and technology being really the third on the rung, because if you don't have the simpler platform and the engagement, doesn't matter if you have an app that has all the bells and whistles. It's really what can we do to get people to be engaged in their health, to not feel alone, to have meals, to have basic human support.
Yeah, I think instead of engagement, I would say simplicity, trust, and technology. So if we win your trust with a simple solution that you find to be helpful, and that means we're not regulating you, we're not being punitive, then you start to lean into our solutions. And that's when we introduce technology in a greater extent. And you can trust us. You can trust that we're not Nigerian princes trying to rip you off. You can trust the fact that we care about you and we care about your long-term health. The health plan may want to get rid of you this year and force you into another health plan. But we are showing that if we believe and trust in you and trust that you'll start to embrace a healthier lifestyle, a path to a healthier lifestyle, that ultimately is going to reduce your costs and make you a profitable member of the health plan, and thus somebody that the health plan wants to keep and wants to invest in.
So, Rick, statistics say that 50% of the Medicare Trust Fund is spent on individual in the last 6 months of their lives. Is there a way to change that?
Absolutely, Megan. If you think about where do we want to die, 80% of us want to die in our home. So right off the bat, we're missing 30% who are not dying in their home. They're dying in an ER, intensive care unit, the emergency room. They're dying on the street trying to get to a hospital. Lots of problems, but only 20% of us are achieving our goal of dying at home. Why is home not more compatible for our end of days? And it's because we have trip hazards, rugs that are filled with insects that cause COPD, that inflame our COPD. We have no rails on our staircase, so we fall on our staircases. We have broken windows that are chilling our apartment because nobody to fix the broken windows. We have door locks that we can't unlock because our hands have gotten frail from arthritis. But let's pick on the rugs. They are trip hazards in many homes because they're scatter rugs, and they've over time they've developed little rolls that stick up and become a trip hazard for a senior who's having difficulty getting around the apartment. If I trip on a rug that should have been flat and it isn't anymore, and I fall and I break my hip, I'm into the hospital now for hip surgery, and lo and behold, I get sepsis while I'm in the hospital, and that sepsis leads to me dying in the hospital. And there you have something that was entirely preventable with a simple solution of identifying trip hazards in homes of seniors. There are a lot of firms that go into the home, and if you go into the home, you should be doing the eye test of looking at, are there broken windows? Is there a rail on the staircase? Are there scatter rugs that need to be flattened? All these things, is there a pet in the home that is filled with fleas? These are all potential medical issues that should be addressed in a social environment. And that's where Healthrageous might be going next, is to offer more than just satisfying the nutrition and satisfying the loneliness. Those are both a bottom rung of Maslow's hierarchy. If you move up the rung, you're looking at what motivates me to want to keep living. And if there's no joy in my life, I could care less if I trip. But if you bring joy into my life by reducing the loneliness and improving my nutrition, then I may be focused on how to get more active. And gee whiz, I keep stepping over that rug. But that will be the death of me if I don't fix the trip hazard.
So preventive care, preventive interventions, that could be a next chapter as well for Healthrageous beyond meal security.
If you look at our healthcare system, it's really a sick care system, and 33% of all dollars go to hospitals, and yet only 1% of the population ever sees a hospital in a given year. So what are the rest of our 99% doing? We're living in our homes, and we like living in our homes. So figure out a way to make home the better environment for health as opposed to the expensive setting of a hospital. That's what's in the minds of a lot of really smart health plan executives, and it's part of our thinking as well.
Well, this has really been enlightening. I am so excited to see what happens with the future of Healthrageous, because you're solving a big problem, a lot of big problems for this important niche. So, Rickley, thank you so much for joining us on Life Sciences Decoded. And I look forward to tracking your progress.
Great. Thanks, Megan.